Hi, I'm Dr. Matthew Norton, the founder of People Plus Purpose. Welcome to the Truth Behind Dentistry Podcast. And today I am happy to have Maryam Shamuell as my guest. Maryam has worked as a clinical dental hygienist for 10 years with a strong focus on disease prevention and elevating patient care through the integration of innovative technologies. She is a guided biofilm therapy trainer, a writer, and a product evaluator with Catapult Education. Maryam loves to empower patients by educating them about the vital link between oral health and overall well-being, as well as mentoring fellow and aspiring hygienists, guiding them to excel clinically and advocate for themselves. She is committed to making a meaningful impact on the quality of patient care. Welcome to the podcast, Maryam.
Thank you so much for having me. I'm excited to be here.
Good. Well, I'm excited for you to be here. So that makes two of us, and we're gonna have an enjoyable conversation about some innovative perspectives. I'm thinking that you would see this still as innovative in the world of hygiene. So I think it's that way. So I'm just kind of looking forward to you sharing your insights and your pearls of wisdom with us today. One of those things is about guided biofilm therapy. I'm certain that there are a lot of people that are with us that know a bunch about that. And I'm thinking there's also people who that's kind of a new topic that they maybe have heard of, but don't really know the details about. So maybe you can talk about how this approach, this therapy helps with overcoming some of the challenges that hygienists face, as far as some of the typical methods that are used.
Sure, absolutely. So to start with, the guided biofilm therapy is evidence-based and minimally invasive, very gentle and effective approach to preventative and therapeutic dental cleaning. Basically, it focuses on biofilm management and disruption, which is the true cause of inflammation and diseases in our mouth and our body. And it does this by using technologies like minimally invasive technologies like the EMS airflow, PerioFlow, and then the Piezon. It's just more patient-friendly approach to doing the dental cleanings today. As far as the challenges with traditional modalities and methods, a lot of time we hear that patients are anxious coming to the dentist. They have recession, they have sensitivity, and they tie in their dental appointments with pain. And it doesn't have to be that way. Guided biofilm therapy and the airflow helps us overcome that because it uses a really gentle powder, which is the erythritol powder. It's only 14 microns in size. And the machine itself, it helps warm up the water. So it efficiently removes that biofilm and deposit without causing any discomfort. It's so comfortable. Patient always tell me this feels like a spa treatment. Another challenge that we have with the traditional modalities is that there's a lot of studies that have been done. And those studies show that with the traditional method, we can miss about 50% of biofilm in hard to reach areas. Like think about around brackets or even around implants threads, deep into the pits and fissures of the teeth. We know we're not getting that with a polisher. Guided biofilm therapy helps us overcome that. I feel confident when I'm using my airflow around implants that I'm removing all the pathogenic bacteria. I mean, when I used to see patients that had all on four, I would be like, oh my God, I'm like, what do I do here? I know there's not much I can do. I know I'm not doing the best I can with the hand instruments. And I would just use water and pray for the best, because I didn't know any better and I didn't have other options that can help me treat the patient better. I think another thing is with the guided biofilm therapy and the airflow, it helps us with a lot of pains we have as hygienists. A lot of times hygienists complain of hand pain and wrist and all of that. With this protocol, we're using the airflow to remove the biofilms above the gum line and up to 4 millimeters below. And then the perioflow subgingivally. And it's really, really comfortable. There's no strain on the hand. And then we're only using Piezon, which is the ultrasonic piece, where there is hard deposit. We're not going on every single tooth, every surface. And that helps reduce the instrumentation part. And that helps reduce that strain on our hands and our body. I think those are some of the major things. And also time. It's more efficient. We're being more efficient with less time. If you compare it with the traditional method, trying to disclose and remove all that biofilm with the polisher and the hand instruments and ultrasonics is going to take us more time. And this method helps us save time. That time we can use educating the patient, maybe taking health scans. That's going to help us educate them even more and do things that are important to do, like blood pressure screening that a lot of times goes out the window because we don't have time, or oral cancer screening, those life-saving services that we can provide to our patients.
So you're feeling like this is both more efficient, this approach. It sounds like it's more efficient, sounds like it's more effective. Are there things that you kind of mentioned things that aren't as good at making sure that you've gotten all the biofilm and it's that there's still risk of pathogens. But are there other things that you're not doing, like in the approach you're taking compared to what would be the most common traditional approach to hygiene? Are there things that you are finding are not effective or to you no longer really meaningful in the hygiene visit? I mean, is it that things are being replaced or more so that we've simply found a better way to do the same things?
It's a better way. And also we don't polish. We don't polish the teeth after we're done because we remove that biofilm with the airflow. It removes it. It's more efficient in removing it, and it leaves the tooth surface and the restoration unharmed. It's not causing any scratches to it. As we know with the polishers, even with the using a low abrasive polisher, it's still causing scratches on the enamel. So that's something that we don't use. We're not ultrasonicking or instrumenting every single tooth, every single surface. So those are some of the main differences.
Okay. When you started to make this transition, were you tempted to feel like, well, since I'm not doing I guess I don't have to do every single tooth, like maybe you left something behind, or was that kind of a hard transition at first to realize I don't need to do everything the way I was doing it before, or?
Well, of course, I would go back, which I always do, go back and check and see if I missed anything. If it's biofilm, I can go back with my airflow and remove it. But yes, of course, I would go back and check and see. And then after doing it for some time, I'm trusting the technology. It's doing its job. I still have to go back and check for hard deposit and then use the Piezon ultrasonic instrument in those spots. But it's definitely cut down on the repetitiveness of us instrumenting every single tooth, every surface.
That's great. So you mentioned about saving time. So about what time savings is there with the approach you're taking now?
I would say probably around 10 to 15 minutes. Obviously, it really depends on the patients. If I'm talking recalls that have been coming in and maintained, then yes, 10 to 15 minutes. The more tenacious that biofilm is, the more it takes us time to remove it.
Okay. And the typical visit before had been what, time-wise?
I mean, our visits in hygiene, it remains an hour.
Okay.
We did not cut down the time because, like I said, now we're providing a better care. Now I spend a lot more time with education. We do itero scans almost yearly for patient, or if we need to do it before that, then we do it. And like I said, we always do the blood pressure screening. We're very thorough with our periodontal charting and all of that. And that was, of course, a challenge trying to get everything in that hour. Now we're really focused on that patient education piece and gathering all the information that we can gather to help them.
It's great. So has this changed the way you see your role then as a hygienist? I mean, is this kind of redefining it a little bit in terms of the sum total of all this that you're offering now?
Certainly, there's definitely been a shift in focus on biofilm more than calculus. Before, it was just like, let me remove all this calculus and hard deposit. And sure, I was still using ultrasonic to disrupt biofilm, but I was doing it blindly. Now we're really focused on removing that root cause. We're being very proactive and helping that oral environment to get back to symbiosis state, because we're removing that pathogenic bacteria from there. And it's been huge. And another thing, the protocol and GBT helps us empower not only us, but also the patient, because one of the steps, which is step 2, we use the disclosing agent, which is a very powerful educational tool, and it gives the patient that visual feedback. They can see what we're talking about. We're always like, we have plaque here, there's a lot of buildup here. They can't see what we see. Now we can use a disclosant that highlights that biofilm in color, and now all of a sudden they're actually paying attention and they're invested and they're motivated to get better. They're the one asking me, how can I get this better? How can I improve? And things like that. And it helps us tie things together as well. So I personally use the GC triplaque disclosing agent. So it shows us biofilm that's been there, like new plaque, and then more mature plaque, and then acidic that's blue. And that helps us kind of figure out, when we see that mature and acidic plaque, it helps us think like, okay, what is the problem here? Is it just poor oral hygiene? We just need to help them find the right tools for them. Or is it due to their diet? Or is there something systemically going on that's causing that acidic bacteria to be present in the mouth, like acid reflux or airway issues and things like that? I think it just helps empower us to feel like the true prevention specialists that we are and be more involved in their journey to health.
That's great. That's great. I like that. So that thus the greater connection between oral and systemic health. But also I like the fact too with the using that disclosing agent, in the sense that I think hygiene appointments and people being less than regular, and people that the challenge for so many practices of keeping hygiene filled, and a lot of that or resistance to a particular frequency of hygiene recall, because it is such a mystery to people. It's remained a mystery. And almost like, I hear you. Yeah, I probably should be back in thus and such amount of time, but I don't really get why, or I'm not seeing it. So I think that's wonderful. Anytime we can paint a better picture for people to be able to engage and be more motivated to participate. So I think that's awesome on multiple fronts with what you just shared there.
Absolutely. I certainly see that with like patient acceptance as far as recare. A lot of times I'll put them on a shorter recare based on what I see, and I get a lot less pushback from the patient, even though they know insurance doesn't cover it, because now they can see it actually and understand why. I love that we have this protocol brings back that disclosing agent. It was the first thing that we drop getting out of hygiene school, because it just gets everywhere and you just can't remove it all with regular polishers and ultrasonic. But with airflow, you can safely go on the tissue, on the gum tissue, on the tongue, and remove it all. And it's just so powerful.
Yeah, that's great. I mean, I feel like this speaks to case acceptance rates all the way around in dentistry, to have more things, even like the iTero scanner, for example. I mean, anytime people can see more what's going on, I mean, you're getting a chance to see more and document, capture these.
Yeah.
But for patients to be able to see just demystifies. It's hard to say yes to things when it's a mystery. And even though through a lot of words, people who feel like, oh, I'm good at influencing yeses to, in care recommendations, the picture is worth 1,000 words, as they say.
Yeah, absolutely.
I can see kind of life with your help into the future, what that could look like versus without. Everything like that should help people be able to say yes to more and more appropriate care rather than how much of it remains unscheduled, which is a source of, loss to the patient, but also at the same time, a loss to the practices that have all that unscheduled care sitting out there. So I'm a fan all the way around of everything.
Right.
So tell me a little bit about the patient's feedback. What's their experience? What are they reporting to you with any of these changes?
I've never had a patient that tells me that they don't like it. Every patient tells me how comfortable it feels and how much more they prefer it over the traditional method, because imagine using the airflow, feeling that warm water and that gentle powder on your teeth versus the sound and the feeling of the metal scratching and scraping around your teeth. It's just, you can't compare the two. It's just more comfortable. I had a patient recently tell me that, asked me if I actually numbed them because they couldn't feel anything. I was like, great, that's the point.
I'm having a way better dental experience than this is good. So that's great. Yeah, I mean, everything.
Feedback a lot where this was the best experience that I've had. Absolutely no pain. And that's always my goal, to provide the best care I can without causing any discomfort so they can return and bring their friends and family, which is what I always see.
Yeah, that's good. What are you seeing longer term when people are coming back over the years, that as a result of this approach, that there is a diminishing of some of those more chronic, kind of chronic responses with the calculus and all that? Are you feeling like you're being so much more effective in the accomplishment of this, that there's less chronic consequences of would often not be holding up well in between visits in hygiene?
Yes, absolutely. Especially with those patients that are keeping up with the protocol that we're setting and that are feeling already motivated and incorporating the things we've talked about, and with us doing our due diligence, removing everything to let that tissue heal, they come back with less buildup, less inflammation, and less bleeding.
Great. That's great. Well, it sounds like a win all the way around.
It's upon every hygienist.
Yeah. Yeah. I mean, I think not only the experience itself, but to feel like there's that benefit, because I know that nobody really likes going to the dentist, and I'm not sure who all in general loves going to the dentist, but to go in and yeah, right. And then to feel like they are falling short on a regular basis, that they're trying to do their best. So I think everything that helps them by virtue of what you're delivering, and then maybe what you can show them more effectively based upon the facts, based upon, the visual data that you have in front of you, that would help to make the whole process more palatable, and to feel like I'm clearly not developing the chronic problems that I was always told are developing, right? So that's got to feel better for patients.
Yes, absolutely. I also try to take pictures, like if I'm seeing them for the first time and I disclose and there's a lot of stuff going on, I'll take a picture with the disclosant to show them the areas, and also helps me to reference back and see how I can help them in the future. And then when they come back and take another picture and compare, most of the time it's been wonderful and motivating them to do better. And now they're like, they ask me, like, I want to see what it looks like. They're very curious.
Yeah.
It just makes that oral hygiene and the patient education more interactive. It's not just lecturing the patient, you need to floss more, you need to do better, and this and that. It's like you said, it's seeing it actually and understanding it. It makes a huge difference versus us just rambling about it.
Yeah. Yeah. That's great. So I have one more question for you before we wrap up. So I love the fact that you've ventured as fully as you have in this direction, that you've not been doing this for forever, right? I mean, it's been 10 years approximately, you said. And yet here you are, you're doing some things that I feel like are ahead of the time in general. And so I think it's good to then ask what other things are exciting or innovative that you see for where you'd like to go, or things maybe that you see coming down the road that others might be interested in.
Another thing that I'm really interested in, it's not something new, but I would love to introduce that, and I already brought it up to my employer, is salivary testing. Because that brings another layer of patient education. Now they can see it on a report, what type of bacteria and how it's directly affecting their overall health. We always talk about it, but again, seeing that on a report, how, let's say, high the bad bacteria is in your mouth and how in the long run it's going to affect your overall health. I think that's very interesting to me, and it takes our job being as prevention specialists to full potential, where we're integrating that oral systemic connection. So that's something that I am really intrigued by, and hoping in the next few months I will be doing salivary testing on my patients. Another thing I would say is the desiccation therapy, those desiccation gels. There's a few companies that makes them. It helps remove or kill that microbe in the mouth in about 10 to 30 seconds. Another thing it does, it helps dry out the calculus and makes it easier for us to remove. I love making my job easy. Those two things I'm really excited about.
That's great. Well, as you get those incorporated and are starting to see those results, then maybe we can have you back for an updated report on how it's added into the rest of the regimen that you're using. So
Absolutely.
it's great. I've often felt like the hygienist backing up just a second, that as far as dentistry being, the mouth being siloed away from so much of the rest of healthcare, as though the teeth and the mouth are not really exactly healthcare in the same way that other parts of the body, right? I mean, it's like, I think it's been kind of put off in a separate box. And I think the hygienist is uniquely positioned to have more of that role of being, in a sense, an oral systemic health consultant, and kind of like the idea of seeing more of an interface with the rest of people's healthcare providers. Because if you're getting as much data that's, as far as the mouth is concerned, as to some of the potential influences on the rest of the body's health, then why not, for the patient's sake, have more of a dynamic conversation that bridges those specialties, right? I think healthcare in general gets very specialized and siloed, and there's not enough conversation between areas of expertise. So I'm kind of excited to see anything that makes for greater efficiency and time saving, so that you do have opportunities to do these other things. I love the idea of adding in salivary testing, and so I'm excited to see what that does for you.
I am so excited. And like you said, a lot of times with healthcare, like, things are just disconnected. Your mouth is separate than your body, but it's not. I mean, look how close this is to your brain and to your heart. So it's all interrelated. You can't be healthy without having a healthy mouth. So I'm really excited, and hopefully we can make a shift in that, and be able to collaborate with the medical team to better help and serve our patients.
Very nice. Well, I've appreciated our conversation today. I've learned some new things, so thank you for that, and appreciate you sharing.
Thank you so much for your time.
Absolutely. So for everybody who has been enjoying this conversation, I just want to thank you for tuning in. We've been with Maryam Shamuell, and learning about guided biofilm therapy and a variety of other things. For anybody who would want to know more, to connect with you, to learn more, is there an avenue, a next step you would want anybody to take?
Sure. You can always reach me by email. It's my first and last name, Maryam, Marya, last name Shamuel, @gmail.com. I am also on Instagram. You can reach me there. It's Maryu, it's the way it's pronounced, _RDH. So either way, I'd be happy to help answer any questions you have.
Very nice. Very nice. Thank you. Appreciate that. So I look forward to seeing you on the next episode. This is Matthew Norton and the Truth Behind Dentistry podcast. See you next time.